Hello, everyone, and welcome to our question lab. Happy to have you guys with us. This evening, we will be doing questions on the topic of pharmacology. And as you guys know, it's a very, very important subject. You'll be using it daily in your practice. And of course, it'll be high yield and will be all over your board exam. So before we get started, I want to make some introductions. Leading tonight's question lab dissection will be Dr. Paras Vakaria. Paras. So today we'll be utilizing the approach that we use in RX Coach. And RX Coach is our new one-on-one tutoring program. What we do is we work with students on an individual basis to identify their strengths and weaknesses, develop a study plan accordingly, and then bridge knowledge gaps and work with them one-on-one to finesse their test-taking skills, because as you guys know, everybody learns differently, everybody thinks differently, and everybody has different strengths and weaknesses. So by working with a student one-on-one, we're really able to tailor step prep to them. And that has really helped a lot of our students maximize their potential and receive some amazing results on their board exams. So if you want to learn more about RX Coach, please visit www.rx-coach.com for additional information. And you can even set up a free consultation to discuss a tutoring program. And looks like we have Kasha Bornstein on with us. Kasha Bornstein is also one of our RX coaches, one of our panelists tonight. I'll give him a second to introduce himself. Kasha.
Good evening, everybody. It's very exciting to be with y'all. I've enjoyed working with Coach COMLEX for the last several months, and looking forward to taking part in the panel tonight.
Excellent, excellent. And we're happy to have you, Kasha. He's one of our RX coaches, one of our great ones. So thanks for coming. And Dr. Vakaria is back on with us. I had a little bit of a technical issue, so I'll let Dr. Vakaria introduce himself.
Yeah, hey, Sean, can you hear me okay?
Yes, sir.
Yeah, hey, everyone. My name is Paras. I am a resident physician in dermatology at UT Southwestern in Dallas, Texas. I originally went to pharmacy school in St. Louis, Missouri, and went back home to medical school back home in Michigan. I've been with RX now for a little under a year, working primarily as an RX coach, working one-on-one with students for the USMLE Step 1 exam.
Wonderful. And we're happy to have Dr. Vakaria with us here today. And we're happy to have all of you. I know we asked you guys what exams you were studying for. And I want to, get to know, when are you guys planning on taking your exam? So I'll open up a poll for you. I'll let you guys submit your responses, and let's see when your exams are. Give you guys a couple more seconds to respond. Excellent. Looks like we've got a few responses, and let's see what you guys said. So by the way, this will be the same poll format that'll show up while we're doing questions. We'll submit your potential answers to. And then of course, after each submission, we will go over the incorrect and correct answers. So let's take a look. It looks like about a third of you guys are taking your test this fall. Some of you guys are taking it this summer between June and July. We've got a lot of you guys taking it in the winter, and some of you guys taking it next year, and some of you guys don't know yet, but that's okay. So welcome to all of you, and thanks for being here. We'd like to do these every Tuesday at 6 p.m. Next week, we'll be covering GI pathology. So make sure you tune in then. We also have a webinar this month with Dr. Lee himself and Dr. Vakaria on the 20th. And we will also be covering pharmacology again. So if you want some more pharmacology practice and review, be sure to join us on the 20th. Those sessions with Dr. Lee are really always very, very insightful. We talked about RX Coach a little bit. We'll talk about it more a little bit later. But without any further ado, I want to go ahead and hand it off to Dr. Vakaria.
Thank you, Sean. So we're going to go ahead and get started with the first question of the day. So question number 1. So the first step is to cover up those answer choices. And as you can see, we've actually gone ahead and already done that. The reason we recommend doing that is so you don't get biased by the answer choices, and you also don't get distracted by the answer choices. You can go ahead and process all the information in the question and just use your knowledge to draw on to best answer the question. So we've gone ahead and covered up those answer choices. The next step is to go ahead and read that last sentence or the lead-in, and we'll read that together. So which of the following drugs is the best choice for treating this child's condition? And as we have you do that, it's important to think of what are the key words in that sentence or the key phrases in that sentence. So the next step is to try to figure out how many steps you think this question may be. Is it a 1-step, a 2-step, a 3-step question? So again, a 1-step question may be as simple as figuring out the diagnosis in the case presentation. A 2-step question would be taking it a step further and asking what is the drug to treat a condition? And then a 3-step question may take it a little further and say, what is the mechanism of action of the drug that is the treatment of choice for this condition? So based on that, it's helpful to think of how many steps a question may be. So go ahead and think about that, and we'll get back to that in just a second. So the next step is to go ahead and read the case out loud. Normally when we work with you one-on-one in individual tutoring sessions, we'll kind of pause after each sentence, have you explain to us what you think is going on, try to tie in all the information together. Since we have a large group of us today, we're not going to do that, but I will take a quick pause after each sentence so each one of you at home can try to gather your thoughts a little bit, okay? So let's start in with this case. A 4-year-old girl is complaining of nausea and severe abdominal pain and is brought by her mother to the emergency department. The mother reports that the girl has ingested 10 to 15 tablets she had found in her grandmother's purse, presumably thinking they were candy. Soon after arriving at the ED, the patient begins to vomit bright red blood. Physical exam shows hypotension and tachycardia. Now, one other thing is, as we have you read each sentence with us, it's important to also highlight the key phrases and key things in that case that you think are important. And that's something that we do one-on-one with you. We won't do that here today, but just keep that in mind. So the next step, again, is to read that last lead-in statement one more time. So which of the following drugs is the best choice for treating this child's condition? And I'm going to hand it over to Sean.
Thank you, Dr. Viccaria. So, you know, Dr. Viccaria mentioned how we like to think about how many steps each question requires. And this is probably a 2-step question, right? We have to figure out what this patient took on accident, and then we need to figure out how we can treat it. Now, unfortunately, we don't know what she took. We have to put those pieces together and figure it out. So let's see what's important here for us to figure out what this patient took and how we should treat her. So we know that she's 4 years old. She's got nausea. She's got severe abdominal pain. She's in the emergency department, and she took 10 to 15 pills from her grandmother's purse. Now, unfortunately, we don't know what the grandmother was taking. So we have to figure it out by looking at the clues given to us in the question. So we know she's vomiting bright red blood, and she's hypotensive and tachycardic. So based on that, I want you guys to input into the question box what you think these pills were that this patient took by accident. I'll give you guys a second. So the first step is to figure out what she took. So we're going to do that first step together. I'm going to let you guys respond in the question box and let me know what you guys think this patient took. And then we'll go to the answer choices and have you guys select an answer. So I'll give you guys a couple of seconds to respond. We have some people saying aspirin, iron, warfarin, NSAIDs, beta blockers, iron again. So those are some really good thoughts, and we'll talk about what the correct answer is to that question, as well as to this question, as we try to answer which of the following drugs is the best choice for treating this child's condition. Now, here are the answer choices. We always like to start at answer choice E and work our way up, and the reason why we do that is because it forces you to go through all of the answer choices and not prematurely select one that you think might be correct because it may not be the best answer. So answer choice E, penicillamine. Answer choice D, this is the long phrase for EDTA. C, dimercaprol. B, deferoxamine. And A, activated charcoal. So I'm going to go ahead and open up a poll here and let you guys submit your responses to what you think the correct answer is for this question. Give you guys some time to respond. It looks like a lot of you guys are on the right track. And remember, there's no penalty for guessing on test day, and there certainly isn't one now. So if you aren't sure what the answer is, just take your best guess, right? We're going to go through and talk about the correct and incorrect answers together. And if you look at the answer choices, you may see a pattern. What do all of these answer choices have in common? We'll talk about that here in just a second. Looks like a lot of you guys have submitted your responses, so let's take a look. It looks like 44% of you guys picked answer choice B. And in second place was activated charcoal. Let's see what the correct answer is. But before we do that, do you guys notice a pattern between these answer choices? If you look, a lot of these answer choices are actually chelating agents. So we just need to figure out which is the correct chelating agent. And the correct chelating agent is deferoxamine, and that is an iron chelator, okay? And how do we know that she is having an iron or an episode of iron poisoning? Well, it's because of the symptoms, okay? Patients that have iron poisoning are going to present with abdominal pain, okay? They're going to be vomiting, they're going to be hypotensive and tachycardic. So these are the clues that really help us figure out that this is an accidental iron poisoning or acute iron overload. Now, in iron overload, it's actually an emergent situation because the patient can develop hypovolemic shock 4 to 6 hours after ingesting these pills, and it's considered an emergency. So what we want to do is what we call volume resection or volume resuscitation by a chelating agent, and deferoxamine is an IV iron-specific chelating agent that binds to ferrous and ferric ions. And if you guys ever get confused about what deferoxamine does, if you look here, you have ferro in the name of the drug, which is like ferrous or ferric, reminding you that this is an iron chelating agent. Okay. Now let's discuss why some of the other answer choices are incorrect. Penicillamine is another chelating agent, and they put a lot of chelating agents in here for you. Penicillamine is a chelating agent that we use in Wilson's disease, and it's a copper chelator. And this patient does not have copper poisoning or copper toxicity. EDTA is a lead chelator, and this patient does not have lead poisoning. Okay, so those two answer choices are out. Dimercaprol is a chelating agent that we can use for 4 different things. It can chelate lead, gold, arsenic, and mercury. Lead, gold, arsenic, and mercury. Answer choice B, we talked about the iron chelating agent, which is the correct answer in this choice. And a lot of you guys selected activated charcoal. And that's a good thought, but it's the incorrect answer. Activated charcoal is used to help absorb toxins. It's helped to absorb toxins, not necessarily iron, which is the problem in this patient's case. So activated charcoal, you may know if you ever had a friend from college or somebody you know that drank too much alcohol, to give them some activated charcoal in the ER. There are even activated charcoal tablets available now. So it's a good thought because this patient does have poisoning, but unfortunately the correct answer in this choice. The correct answer was deferoxamine, which is here because this patient had iron poisoning. And some of the findings you'll see here is adult iron tablets may look like candy, which is what this 4-year-old thought it was. And they told us that in the question stem, okay? The mechanism of action is that they cause cell death. The mechanism of action of iron poisoning is it causes cell death, due to free radicals, and we want to avoid that. Signs and symptoms: abdominal pain, vomiting, GI bleeding. Okay, so great job on that question. A lot of you guys got it right. Those of you who didn't, hopefully we all learned something. Let's move on now to question 2. Dr. Vicaria.
Thank you, Sean. Great job explaining that question. So question number 2. Once again, we will go ahead and cover up those answer choices for you. So as you can see there, those answer choices are not visible. So we will go ahead and read that last sentence, that lead-in question. Which of the following is the mechanism of action of the antibiotic most likely given to the patient? Once again, which of the following is the mechanism of action of the antibiotic that was most likely given to this patient? So again, the next step is to try to figure out how many steps you think this question could be. 1 step, 2 step, 3 step, even more. So go ahead and think about that for a second. We'll talk about that in just a few seconds. And I'm going to go ahead and start with the case presentation. And again, we'll take a quick pause after each sentence. A 12-year-old girl is brought to her pediatrician because of the recent onset of bruising. Her mother states that her daughter has been healthy other than a recent infection she developed on a trip to Guatemala that was treated with an antibiotic in a small rural hospital. Physical exam is remarkable for non-blanching purple and yellow bruises on her legs. Complete blood cell count demonstrates a hemoglobin of 8.4, hematocrit of 25.2%, a mean corpuscular volume or MCV of 95, a white blood cell count of 2.2 or 2,200, and a platelet count of 50,000. So once again, which of the following is the mechanism of action of the antibiotic most likely given to the patient? Back to you, John.
Excellent. So once again, let's think about how many steps this question is going to require. So first, we need to figure out what she has, what she was given, and what the mechanism of action is. So before we get to the mechanism of action, let's figure out what's going on with this patient. So we know she's 12 years old, okay? She's brought to the pediatrician because she has bruising. Now her daughter has been healthy other than a recent infection she developed on a trip to Guatemala, during which she was given an antibiotic. Now, physical exam is remarkable for non-blanching purple and yellow bruises on her legs. And take a look at her blood count. What do you think this patient has? What is the name of the condition this patient is dealing with? Let's type it into the question box and see if we can get that right. And then we can go to the second step or the third step here and try to get the correct answer. Looks like we have some people saying aplastic anemia, some people saying pancytopenia. Those are very, very good thoughts. Pancytopenia again. So let's take a look now at the answer choices, and we'll go over the correct answer to this question, as well as to what the correct mechanism of action is for this medication. Answer choices are E, inhibition of peptidoglycan cross-linking in the cell wall. D, inhibition of DNA gyrase. C, DNA damage with toxic free radical metabolites. B, binding to the 50S ribosomal subunit. And A, binding to the 30S ribosomal subunit. I've launched the poll. I'll give you guys a second to answer. Once again, if you don't know what the answer is, if you're not 100% sure, don't worry. Take your best guess, and we're going to go over all of this together. Remember to keep in mind, in order for us to get this question correct, it's at least 2 steps. We must first know what this patient is dealing with, because if we can't figure out that first step and keep our thoughts organized, we won't be able to answer this question. That's why it's important, like Dr. Vacaria said, to always ask yourself, how many steps does this question require? Looks like we've got about half of you submitting your responses. We'll wait a couple of more seconds to let the rest of you respond. Once again, if you aren't completely sure, don't worry, take your best guess, and we're gonna all learn together after this. Excellent, and it looks like about 2/3 of you guys have voted, so let's take a look. Looks like 39% of you guys picked B, binding to the ribosomal subunit, the 50S ribosomal subunit. And in second place was DNA damage with toxic free radical metabolites. Let's see what the correct answer is. And the correct answer is B, and 39% of you guys got it right, so good job. And that answer is binding to the 50S ribosomal subunit. Do you guys know what medication we're speaking about? If so, please go ahead and enter the name of that medication into the question box. It's associated with one very, very common side effect. I'll give you a clue. And that common side effect is gray baby syndrome. Now that I've told you that, go ahead and tell me in the question box, what is the correct medication in this case? Which is the antibiotic administered to this patient? It is associated with gray baby syndrome. And looks like everybody now is getting that right, and it's chloramphenicol. Excellent. And this is one of those things that you have to keep in mind. Even though that's a very high yield point, and once I mentioned it, a lot of you knew it, the question didn't ask you that or mention it. It mentioned other things about the drug that you should also know. So let's discuss those together. Chloramphenicol, it blocks peptidyltransferase at the 50S subunit, okay? It's bacteriostatic, and we use it, and the side effects, are a dose-dependent anemia or dose-independent aplastic anemia, okay? So that's what they're asking you about, because this patient presented with aplastic anemia. It's because they were given chloramphenicol, which, as you can see on your screen from this page of first aid, can cause a dose-dependent anemia or a dose-independent aplastic anemia. Now, those side effects students are less familiar with, but they are almost always familiar with this one, which is gray baby syndrome. We use this for meningitis, for Neisseria, for strep, as well as rickets diseases like Rocky Mountain spotted fever. Now, we don't use it much in the US anymore because of its toxic side effects, but in countries that are developing that don't have some of the resources that we're blessed with here in the United States, we do give this drug because it's a very low cost option. And they told you in the question stand that this patient had taken a trip to Guatemala. So that was one of your key things to figure out what drug it was. Now let's discuss why some of the other answer choices are incorrect. If you look at her blood test, it shows that she has pancytopenia. So she's got low hemoglobin, hematocrit, low white blood cell count, and low platelet count. So that points to anemia. But given the fact that her MCV is normal and she doesn't have any underlying chronic diseases, the most likely type of anemia is aplastic anemia, which is what makes this answer choice the correct answer. Okay, keep in mind that the bone marrow suppression that occurs with chloramphenicol is reversible. It's reversible, okay? Answer choice E. Answer choice E is talking about penicillin. And penicillin is a beta-lactam drug that functions by inhibiting the peptidoglycan cross-linking. If they had a penicillin allergy, they would most likely present with an anaphylactic reaction. And we don't see that here. What we see is aplastic anemia, which makes answer choice E incorrect. D, they're talking about ciprofloxacin. This is another drug that you should be familiar with because they'd like to ask you on the exam questions about side effects such as tendinitis or tendon rupture or cartilage malformation, okay? And that's why we don't like to give it when there's a developing fetus. The patient doesn't have any of these complaints. There's no tendinitis here, there's no tendon rupture, there's no cartilage malformation mentioned, okay? And ciprofloxacin is an inhibitor of DNA gyrase, which is answer choice D, which makes answer choice D incorrect. Answer choice C is talking about metronidazole. And you guys probably all remember that mnemonic, get gap at the metro or get gap in the metro, right, from first aid. But metronidazole side effects will include disulfiram-like reactions with alcohol consumptions, headache, and metallic taste. And we don't see that in this patient. The way metronidazole works is by forming free toxic radical metabolites. So that is answer choice C, but it too is incorrect. Answer choice B was the correct answer, and we talked about it. And it was close because it said 50S subunit, and this answer choice is 30S. This is probably talking about gentamicin, which binds to the 30S subunit. And it's associated with nephrotoxicity and ototoxicity. And we don't see nephrotoxicity or ototoxicity in this patient. What we see is aplastic anemia. This patient had traveled to a developing country, presented with aplastic anemia, and all the classic symptoms, leading us to the correct answer of chloramphenicol, which binds to the 50S ribosomal subunit. So this question is a good example of making sure that you pick up on all the clues, but also should show you that knowing just those high yield side effects isn't always enough. You have to know the rest of it as well. So for those of you who got it right, great job. For those of you who didn't, hopefully you learned something from it, and we'll get it right on test day. And we'll take a look here at this one slide about RX Coach before we move on. I mentioned RX Coach earlier at the beginning of today's question lab. RX Coach is our new one-on-one tutoring program. We go through the steps just like I did with you here today and Dr. Beccaria did earlier. What we like to do is first start with an assessment, and we use that assessment to get a baseline of your strengths and weaknesses, and then we come up with a personalized study plan. Because if you make a personalized study plan according to your strengths and weaknesses and study the right things in the right order, not only will you be more efficient, you will learn the right way and perform better on test day. So we start with that assessment and make a personalized study plan. And then we meet with you on a one-on-one basis to do questions together on that subject. And of course, we'll answer your questions and explain things to you if needed. But as we start to dissect questions together, as we hear you think out loud, we can bridge those knowledge gaps, but also work with you one-on-one to figure out exactly how you think and how we can make you think like a doctor and think like a better test taker to get the maximum score possible on testing. All of our tutors are highly trained and certified. And if you're interested in being one of our success stories like this testimonial here, with regards to my experience so far, it has been excellent. My coach is great at explaining concepts that I find complicated. And he does an incredible job guiding each session in a way that fills the gap in my knowledge for step one. Overall, I am very glad to be a part of RX Coach. All of our coaching packages include access to RX 360 Plus, which includes RX Bricks, our question bank, express videos, and flash facts. So if you're interested in working with somebody like we're working with you today on a one-on-one basis to really get the most on test day, maximize your potential as you're studying, please visit rx-coach.com and schedule a free consultation to discuss the program and how it can benefit you. If you want some generalized study advice or a free study planner, please visit us at firstaidteam.com. And with that, I will turn it back over to Dr. Beccaria.
Thank you, Sean. So let's go ahead and dive into question number 3. So once again, we are going to cover up those answer choices. That is the first step. And then we're going to go ahead and read that last sentence or the lead-in question. What is the predominant mechanism of action of this anticoagulant? So again, try to keep in mind what you think are the important phrases or words in that question. And then next, what we'll do is try to think again of how many steps this question could be. Once again, it could be a 1-step, a 2-step, a 3-step. So go ahead and think about that, and then we will talk about it in just a few seconds as well. Now I'm going to go ahead and start reading the case. And again, take a quick pause after each sentence so we can gather our thoughts. A 72-year-old man presents with sudden onset shortness of breath, left leg pain, and right-sided pleuritic chest pain. His temperature is 100 degrees Fahrenheit. Blood pressure is 110/70. Pulse is 110 beats per minute, and respiration is 26 breaths per minute. A diagnosis of pulmonary embolism due to a deep vein thrombosis, or DVT, is made. An anticoagulation therapy is initiated. The anticoagulant selected is administered subcutaneously and does not require laboratory testing to monitor the degree of anticoagulation. Once again, what is the predominant mechanism of action of this anticoagulant? Back to you, Sean.
Excellent. Thank you, Dr. Vacaria. So once again, let's take a look at the clues in the question. We know this patient is 72 years old. He presents with sudden onset of shortness of breath, left leg pain, and right-sided pleuritic chest pain. His temperature is 100, blood pressure is 110/70, pulse is 110, respirations are 26 a minute. A diagnosis of pulmonary embolism due to a DVT is made and anticoagulation therapy is initiated. So this medication was administered subcutaneously and does not require laboratory testing. So what do you think this medication is? Which is the anticoagulant that we're talking about? Why don't you guys let us know in the question box, and then we will go over the mechanism of action and this question together. Looks like we have a lot of people saying heparin, low molecular weight heparin, enoxaparin. Some really, really good thoughts here. So let's take a look at what the answer choices are, and then we'll go over the correct and incorrect answers together. Answer choice E, plasminogen activator. Answer choice D, indirect factor 10A inhibitor. C, indirect activation of plasmin. B, direct factor 10A inhibitor. And A, decreased synthesis of factor 2, 7, 9, and 10. I'm going to open up the poll and give you guys a few seconds to select your answer. This is a high yield topic, and one of these drugs is definitely going to show up on your board exam. So we're going to go through what these drugs are and how they work in just a second. But before we do that, take your best guess. If you don't know what the answer is, select an answer choice, and we'll go over the correct and incorrect answers here shortly. Looks like about half of you guys have answered. I'll give you guys a couple of more seconds. And as you guys can see today, just by going step by step together, we're having more people get these questions right than we normally do in question labs, even though we've selected some very challenging questions. It just goes to show you that the approach you have to questions, the way you think about things, really makes a big difference. So good job to all of you here today. Excellent. And answer choice B, direct factor 10A inhibitor. 46% of you guys picked that, and 26% of you guys picked indirect factor 10A inhibitor. So let's take a look at what the correct answer is. And the correct answer is D, indirect factor 10A inhibitor. Now, why is that the correct answer? Well, that is the correct answer because that is how low molecular weight heparin works. Now, what's the difference between heparin and warfarin? Well, there's an easy trick I like to use to keep those two separate. I like to go back to the alphabet. H comes before W, so heparin comes before warfarin. The word acute comes before the word chronic. That's how I remember that heparin is used to treat acute conditions and warfarin is used to treat chronic conditions. Does it cross the placenta? The word no comes before the word yes, which is how I remember that heparin does not cross the placenta and warfarin does cross the placenta. So here we're talking about low molecular weight heparin, and the mechanism of action of low molecular weight heparin is to indirect factor 10A inhibitor. Now, some of the clues that would have taken you to the correct answer are not only the symptoms, but the fact that it was given subcutaneously, because low molecular weight heparin is given subcutaneously. And the way that an unfractionated heparin work are that they bind to antithrombin 3, which then inactivates factor 10A and thrombin, which is why it is indirect factor 10A inhibitor. Okay? So that is the answer, low molecular weight heparin. And we like that drug because, like this question said, we don't have to monitor PT and PTT, and we can give it subcutaneously. So those were the two clues in the question that would have helped you get this correct answer. Okay, now let's talk about the other answer choices. Answer choice E. This is talking about TPA. And we use TPA for thrombolysis after myocardial infarctions. And what it does is it cleaves a peptide bond, producing plasmin, which eventually catalyzes the breakdown of fibrin. But we're not talking about an MI here. We're not talking about a stroke here. We're talking about a PE due to a DVT. Answer choice D was the correct answer, and we went over that. Answer choice C. This is talking about thrombolytics, okay? So we have an enzyme called plasmin, and it cleaves thrombin and degrades fibrin clots. And drugs that aid in the conversion of plasminogen to plasmin are termed thrombolytics. So drugs in this category are drugs like streptokinase, alteplase, reteplase, and tenecteplase. And these drugs are indicated for treating early MI, early ischemic and early ischemic stroke, as well as severe pulmonary embolism. But the reason why this is the incorrect answer is that these drugs are administered intravenously, and they do require lab monitoring. And they told us in this question that this drug was given subcutaneously and did not require lab monitoring. Okay, so that's why answer choice C is incorrect. Answer choice B. This is tricky because it is close to the correct answer, but instead of an indirect factor 10A inhibitor, it is a direct factor 10A inhibitor. This is talking about drugs like apixaban and rivaroxaban. And the way I remember that these are direct factor 10A inhibitors are because apixaban and rivaroxaban directly have the letters XA in the name of the drug. Okay, so that's how I remember that those are direct factor 10A inhibitors. Now, these drugs are commonly used for the treatment and prophylaxis of PE and DVT and for stroke prophylaxis, especially in patients who have AFib. Now, one major benefit of this drug is that they also do not require coagulation monitoring. So we don't have to do labs with these either, which is why this drug is an appealing choice. But these drugs are also these drugs are not given subcutaneously. They are instead given orally. So direct factor 10A inhibitor is the incorrect answer. And the way I remember it is by the fact that rivaroxaban and apixaban directly have XA in the name of those drugs. Answer choice A. This is the mechanism of action of warfarin. And we're dealing with an acute condition here. And we talked earlier about the alphabet and how warfarin comes later and the word chronic comes later. We use warfarin more for chronic conditions. And the way warfarin works is that it interferes with the normal synthesis and activation of vitamin K dependent factors such as factor 2, 7, 9, and 10, and protein C and protein S. So warfarin is used when we need chronic anticoagulation, and it also requires monitoring of PT and INR, okay? So this is not the correct answer because we have more of an acute condition, and it told us that we are not needing to monitor this patient's lab. So the correct answer in this case was low molecular weight heparin. For those of you who got it right, once again, great job. For those of you who didn't, hopefully you got something from the explanations, because heparin, low molecular weight heparin, warfarin all of these anticoagulants are high yield, and you're sure to see them on your test and, of course, in practice. And with that, I will hand it back to Dr. Vicaria.
Thank you, Sean. So we will go ahead and do our fourth question. So once again, you can see that we have gone ahead and covered up those answer choices. And now I'm going to go ahead and read that last part, that lead-in question. Which of the following is the major mechanism of the chemotherapeutic agent that was most likely used to treat this patient's seminoma? Once again, which of the following is the major mechanism of the chemotherapeutic agent that was most likely used to treat this patient's seminoma? So one, keep in mind what you think are some helpful or key words or phrases in that question. And two, also be thinking of how many steps you think this question is, and we'll talk about that in just a second. So to the case, a 24-year-old man comes to the physician for a routine physical exam before beginning a new job. The physician notes a small, firm nodule on the patient's left testicle, and he is subsequently diagnosed with a testicular seminoma and referred to an oncologist. Soon after beginning high-dose chemotherapy, the patient returns to his primary care physician because of a 1-week history of dry cough and shortness of breath. His temperature is 98.7 degrees Fahrenheit, and his pulse is 82 beats per minute, and his respiratory rate is 17 breaths per minute. A cardiac examination discloses no murmurs or gallops, and both lungs are clear to auscultation without wheezes. There is no dullness to percussion, and imaging results are shown. So once again, which of the following is the major mechanism of the chemotherapeutic agent that was most likely used to treat this patient's seminoma?
Excellent. Thank you, Dr. Vicaria. So in the last 3 questions, I kind of highlighted the important things in the question and did the first step for you, and we did it together. And this time I'm going to give you guys a second to take a moment and let us know what is the drug that they're talking about, because in order for us to answer this question, we need to figure out what's going on, what's the drug, and what's the mechanism of action. So I'll give you guys a second to respond in the question box based on the clues in the question and tell us what chemotherapeutic agent they are referring to. So we'll give you guys a couple of seconds to respond. Excellent. Looks like we've got a lot of people with the correct answer here, so that's great. So let's move on now and see what the answer choices are, and then we will go over the correct and incorrect answers. Answer choice E, stabilization of microtubules against depolymerization. D, inhibition of topoisomerase 2. C, inhibition of microtubule polymerization. B, formation of superoxide or hydroxide radicals. And A, alkylation of DNA. I'm going to open up the poll and give you guys a couple of seconds to select your answer choice. This is the last question of the evening, so hopefully you guys are learning a lot, and hopefully we'll all get this question right and move on to our raffle. Now, I didn't mention this earlier, but we have a raffle at the end of the webinar, and you must be present to win, or 2 lucky people are going to win some free stuff. So make sure you stick around. You must be present to win. And a lot of times we do these raffles and the person that wins isn't here. So you have a shot of winning, so stick around for our special offer, for our raffle and for our special offer. Give you guys a couple more seconds to respond. Once again, the question lab next week will be on GI pathology. And the webinar with Dr. Lee and Dr. Vicaria on July 20th will also be on pharmacology. So make sure you tune in. Give you guys a couple more seconds to respond. Excellent. Let's see what you guys selected. 30% of you guys selected answer choice B, which is formation of superoxide or hydroxide radicals. And then 25% of you picked inhibition of microtubule polymerization, and 24% picked alkylation of DNA. Let's see what the correct answer is. And the correct answer is B, formation of superoxide or hydroxide radicals, because the drug they're talking about is bleomycin, which was given a response given by many of you guys in the question box. So very well done. Bleomycin induces free radical formation and breaks in DNA strands. We use it for testicular cancer, Hodgkin lymphoma, and it causes pulmonary fibrosis. And if you look at the question here, you see this patient has pulmonary fibrosis, and they even told you about some of those signs and symptoms, okay? It said both of his lungs were clear, but they gave you an image with some fibrosis in it, all right? They also told you that he had a testicular cancer. So you had the clues there to get to the answer of bleomycin. And bleomycin patients generally, one of the side effects, like I said, is going to be a pulmonary toxicity and fibrosis. It is a first-line treatment for testicular tumors. Bleomycin is it's a mixture of glycopeptides, and they can produce superoxide and hydroxide radicals that attack and break DNA bonds, which causes them to fragment. So the correct answer was bleomycin. And the way it works is through these free radicals. If you look at the patient history, they told us about a dry cough and shortness of breath, leading us right towards those pulmonary symptoms. Then we saw the CT scan, which showed some cystic degeneration and some interstitial thickening and fibrosis, as well as cyst formation, very clearly painting a picture of pulmonary toxicity and fibrosis. So great job to those of you guys who got it right. Now let's review some of the incorrect answers. Answer choice E is talking about paclitaxel. And paclitaxel is a M-phase specific chemotherapeutic agent. And what it does is it prevents the depolymerization of microtubules and causes arrest during anaphase. Now, paclitaxel is used to treat ovarian and breast cancers, not testicular cancers. And if it was, and even if you thought that was still the answer, the side effects of paclitaxel are hypersensitivity and neutropenia. So no matter how you dice it with paclitaxel, it really doesn't fit the symptoms or the side effects of this patient. Etoposide, another easy drug, it has the word topo in it. It inhibits topoisomerase 2, okay? The most common side effect of etoposide is going to be myelosuppression, GI upset, and alopecia. Pulmonary symptoms with etoposide are really rare, so that's not one of the side effects associated with etoposide, which makes that the incorrect answer choice. C is vincristine. It's similar to paclitaxel, okay? But this, instead of what paclitaxel does, is it prevents depolymerization. Vincristine, on the other hand, prevents microtubule polymerization. And we use vincristine to treat acute lymphoblastic leukemia, Wilms tumor, and lymphomas, but not testicular tumors or carcinomas, which is what this patient has. Now, some of the side effects of vincristine include cellulitis and peripheral neuropathies. Now, vinblastine, on the other hand, similar to vincristine, can be used for testicular cancer, but you're going to have more of those peripheral neuropathy-like side effects. Respiratory depression, pulmonary fibrosis, pulmonary toxicity are not associated with either vincristine or vinblastine. We talked about answer choice B, and that was bleomycin and why that was the correct answer. Answer choice A could have several different choices. So it could be mitomycin C, which is another alkylating agent. Now, mitomycin C can cause a bronchospasm 12 to 14 hours after administration, but it does not see the severe kinds of, we don't see the severe kinds of pulmonary symptoms or the imaging that we see in this patient. Another drug which is similar in sound or can confuse people to bleomycin is busulfan. That's also an alkylating agent, and it's also associated with pulmonary complications. So busulfan, bleomycin, they both cause pulmonary complications, but busulfan is not used to treat testicular cancer. Then there's another one that students think about when we talk about alkylating agents, and that's doxorubicin, and that also can generate free radicals, but its main adverse effect is going to be biventricular dilated cardiomyopathy. And the way I remember that with doxorubicin is by its brand name, which is adriamycin, and adriamycin is ADRIA, which is very similar to atria, which is ATRIA, which is a part of the heart. And that's how I remember that doxorubicin or adriamycin can cause that dilated cardiomyopathy and that heart-related side effect. So that was the last question of the evening. I hope you guys found today's session to be informative.